So what I'm going to do right now is talk about the anatomy of the most common injuries. We have Genevieve here as our model. I'm going to start at the hip joint. As you can see, here is her ilium. It's her right leg. You can observe her gluteus maximus. As you cut that, and you'll see in the anatomy book, underneath it is a muscle called your piriformis. It starts here on your sacrum, and it pinches into a triangle and attaches there on your greater trochanter. The muscle is used when you run to help you with balance and propelling yourself forward. As you go, in this case, towards the ceiling, next to the piriformis is gluteus minimus and gluteus medius that sit in this position on the outside of her hip. They also come down and attach to the greater trochanter. So just to review, piriformis starts on your sacrum and comes over to your greater trochanter. Gluteus minimus and medius start on your ilium and come down to your greater trochanter. You'll have another view in the anatomy book. We talked about the muscles that attach to the greater trochanter. The tissue on top of these muscles, right where my hand is, that starts at your ilium and comes all the way down to the side of your knee, is called your IT band, or your ilium hip joint, all the way down to your lower leg is called your tibia. So it's your iliotibial band, or IT band. As I told you earlier, it attaches in this little notch called Gerdy's tubercle. It also splays like that to your kneecap, to your lateral quad, and to your hamstring. When it splays and attaches to your kneecap, this area is called your lateral retinaculum. It's important that when runners have knee pain, if it's coming down the side of your leg to the side of your knee, it's mostly IT band. If it's on the top outside of your leg, it's mostly lateral quad. And if it's in the back outside of your leg, it's mostly lateral hamstring. The importance is that you stretch all three: IT band, lateral quad, and this will relieve the knee pain that you have either on the top of your knee, the side of your knee, even the front of your knee. We had you see Genevieve lying down on her side. Again, we're going to stay with her right leg. Now we're showing you a front view where you could see the IT band comes down on the side, quad comes down in the front, lateral hamstring is back here. On the inside of her knee is a group of muscles called your pes anserinus. Now, when all this tissue attaches to the knee, whether it's attaching to the tibia, to the kneecap and the lateral retinaculum, to quad muscle going to patella tendon, kneecap is also known as your patella, and inferior patella tendon attaching from your kneecap to your tibia, it's important to note in the anatomy book that when the muscle attaches to the tendon and the tendon attaches to the bone, it attaches with a structure that's like your oil in an engine, and it's called your bursa. So, if you're ever eating a chicken leg, and you're eating the meat of a chicken leg, and you come upon the rubbery part of the chicken leg, that's the tendon. Where that rubber attaches to the bone, there's a bunch of gooey stuff that if you rub it in your fingers and then you put your fingers under water, it will bubble up like oil. That is called the bursa. So when you have a tendinitis, you also get a bursitis with an overuse running injury. This is why it's important to not only ice massage your quad and your patella tendon, ice massage your IT band, and ice massage your hamstring to take care of the tendinitis. At the end of your sequence where you first ice massage, foam roll, stretch, go for your run, come back and stretch, and then eventually ice pack your knee, where you're going to use a big gel pack. That's important to take down the inflammation of that bursa. Okay, now we're going to look at the anatomy of Genevieve's right lower leg, her calf muscles. You have two main calf muscles. Your gastrocnemius, that comes up and attaches above your knee, and it's the bigger, thicker one that's closest to your skin. Underneath it you have a muscle called your soleus that we're going to show you by having Genevieve bend her knee and go on her toes. And now you can see her gastroc forms here, and then underneath it is her soleus in here. That attaches below your knee. It is underneath your gastrocnemius. Both attach to your Achilles tendon. In the anatomy book, it will show the gastrocnemius, and then we'll cut it, and we'll show you the soleus underneath. It's important to note this because as Genevieve brings her foot down and keeps her leg straight, and you're doing the straight leg stretch, you'll see you're getting the calf part called the gastrocnemius. As she now keeps her heel down and bends her knee, because she's bent her knee, she's taken out the gastrocnemius and she's stretching her soleus. Both of these attach to your Achilles tendon, so you have to do both stretches. Same thing applies in the sequence of the ice massage, the foam roll, the stretch, the jog, the stretch, and then the ice pack. So again, the last thing you want to finish with is an ice pack. You have the muscles, you have the tendon, you have the bone, and you have the bursa right in here where the tendon attaches to the calcaneus. So if you're having problems, again, make sure you finish up with an ice pack.